Hi, today we're going to talk about starting IV fluids on your patient. So once you have a patient that has an established IV line, or you may have to start the IV on the patients, please refer to that video if you need to go back and review that. But in this patient, we have an established saline lock that we're going to go ahead and start IV fluids on. Now, there's two ways we can hang IV fluids. One, we can use a gravity set, which is just an IV administration set, or we can use our pump. So we're going to go through and look at both of those. So first thing you want to do is review your healthcare provider's orders to determine what type of fluid, how much volume, the flow rate, and how long that's going to institute. So today we have orders to begin a normal saline drip on our patient running at 100 milliliters an hour. So when I gather my supplies, I've got my IV administration tubing and I've got my normal saline, and we're going to start with the 500 milliliter bag. So as we get started, we're going to make sure that we've identified our patient properly, that we've explained to them what we're doing, and let them know we're starting IV fluids. And then next, we're going to perform hand hygiene. When I look at my bag of IV fluids, one of the things I want to look at is it the right solution? And so I can see here, we've got 0.9% normal saline, and I want to look for the expiration date. And so this bag expires in July of 2020. And so you want to make sure you do review your expiration date and make sure you're not hanging fluids that are out of date. Now, most of our fluids are kept in a little plastic bag, and they're usually pretty easy to tear open. So we want to go ahead and get them open, and then we want to go ahead and open up our pump. Now, our tubing. Every bag of tubing you'll see has the flow rate listed on it. On this one, we've got 15 drops per milliliter. And so that just tells us if we have to do a drug calculation with gravity-fed IV fluids, that's what we're going to use for our drop factor. Remember, when we start IV fluids, we want to make sure we're paying attention to sterile technique. So you'll see we have the top of our IV fluids and the bottom that connects to the patient. So the first things first is you want to take your IV fluids, and I often like to use my pump as an extra hand. So I can go ahead and hang that. I always like to hang the bag facing out so I can always see what is in there. We want to go ahead and remove the plastic tab, and you can see when I take that off, nothing happens. And then we're going to go to our tubing. Now, important step here, you want to go ahead and close the roller clamp, because if we go ahead and insert this into the bag, it's going to start running for us. So we want to remove the top of our port here, maintain good sterile technique, and go ahead and slide this in. And sometimes they're a little stubborn. Just twisting motions. The next thing, you want to kind of squeeze your drip chamber and allow some fluid to get in. Every tubing usually has a line on here, but we want to have enough fluid in there to be able to drip, but we also want to see our drops fall so we can count appropriately. Now we need to prime our fluids. I like to go ahead and bring a trash can over and very carefully open up my little cap here, maintaining sterility with that. And then go to my roller clamp and open it. Now you can see that water will come down pretty quickly. And we want to clear out the fluid until all the air bubbles are out, and then go ahead and close the clamp. Now, we need to attach this to our patient. So if we had one of the Curos, you see these green caps? If we had one of those caps on top of our port here, and it's been there for at least 2 minutes, then we don't need to cleanse the site. But since this doesn't have one, we're going to go ahead and wash the site and make sure we scrub that hub very carefully. And you want to make sure, because anything we put on here, if there's any bacteria or problems with it, we're going to be instilling that right directly into our patient. So now we take our tubing and we go ahead and attach it to the Luer lock, so you kind of want to push in and twist. Now, all saline locks should have the lock closed if they're not being in use, so we want to make sure we go ahead and open that. And then I always like to use a piece of tape to secure this, and so I'll make sure I come back and do that at a later time. Now, we want to go ahead and we want to figure out our drops per minute and how many drops we need to count. So what I want you to do is I want you to calculate what your drop factor or your drip rate will be in drops per minute. So you have 100 milliliters an hour of fluids with 15 drops per milliliter, and you want to figure out how many drops per minute. So I want you to take a couple seconds and figure out your dosage calculation. Okay, did you get 25 drops per minute? That's how many drops per minute we want to figure out to run 100 milliliters an hour. And this is how you set up the problem. Remember, we're going to start with drops per minute. So we have 15 drops per milliliter. We have 100 milliliters per hour. And since we need minutes, we need to convert our hours to minutes. So you get 1,500 divided by 60, and that gives you 25 drops per minute. Now we need to count that out and figure out how to do that if we don't have a pump available. So this is the way I look at it. If I have 25 drops per minute, well, I can stand here and count 25 drops every minute, or I can start looking at it in shorter periods of time. So 25 drops per minute would be 12.5 drops per 30 seconds, which would be about 6 drops per 15 seconds. So what you're gonna do is you're gonna use your watch, and you're gonna watch your numbers, and you're gonna open up your drip rate here, your slide clamp, and you're gonna count 6 drops for every 15 seconds. So you wanna be watching your watch and just playing with the dial to try to get you to about 6 drops for 15 seconds. And that looks about right. So when we have about 6 drops for 15 seconds, that's going to end up being 25 drops per minute, which will equal out to 100 milliliters an hour using this drop factor. Now, before we leave the patient, you want to make sure you've secured your tubing to their arm using a piece of tape. You always want to label your bag here. I like to pull one of the patient labels out of the chart that has their name and medical records number and place it down here along the lower part of the tubing, not to block their expiration date and not to block what is in the fluid here in the bag. Okay, so we've got our label here that has our patient's name, and I've put the date, the time, and my initials as to when we hung it. In Islander Regional Hospital, our primary tubing is good for 72 hours. So I've got my Change Friday sticker that I'm going to go ahead and label my tubing with. Last but not least, I'm going to take my piece of tape. I personally like to use paper tape because it doesn't stick really well to patients, or sticks really well to patients, but not their skin. And so I've secured my IV line. I've got my clamp open. I've got my fluids running at the prescribed rate. I've double checked that my patient is comfortable. And then before you leave the room, I always like to check, is there anything else that the patient needs before I go? I like to perform hand hygiene, and then we can go off along our day. So there you go, starting IV fluids with primary tubing without a pump.